Most nurses skip this step during NG tube insertion, and it can harm the patient. Let's quickly review the safe and correct way to insert a nasogastric tube. First, explain the procedure, perform hand hygiene, and position the patient in high Fowler's position. Measure from the nose to the earlobe, then to the xiphoid process. This step is commonly skipped. Don't skip it. Lubricate the tip of the NG tube to reduce discomfort and prevent trauma. Gently insert the tube through the nostril. The patient to swallow as you advance the tube. Stop immediately if the patient coughs, chokes, or shows respiratory distress. Confirm placement using pH testing, aspiration, or institutional guidelines before use. Secure the tube properly and document the procedure according to hospital policy. Correct NG tube insertion protects your patient and builds your clinical confidence. Like, subscribe, and comment more nursing skills videos for quick clinical tutorials.